Oh, recording has started. We could have 10 talks on all the different, uh, you know, psychiatric diagnoses and their nuances associated with children. Um, we just don't have time to do all that today. And the same thing with development. So I really want to focus on like in having a good quality engagement with a child, which I think is super valuable to make the clinical aspect easier. When I was a resident, one of my advisors said to me is, I said to him, like, I really hope that I can be, just as good of a doctor as you are one day, which is probably a silly thing and naive thing to say to him. But he looked at me and said, don't be a good version of me, be a great version of you. And I really want to emphasize that I am saying all this information today, and it is my experience and my opinion on things. I'm one physician, I'm one clinical person. There are lots of people who work with kids who have really, really great ideas and really, really good engagement. What people should do is take what I'm saying and mesh that with what other people say, and then find how that makes you comfortable and how can you engage with a child using those skills, but in a way that you're comfortable with. Because you're never going to be me, and I'm never going to be you. You got to be the best version of who you are. You got to feel comfortable with it. And if you saw me work live with a kid, most people will look at me and say, I will never act like that, because I can be a bit over the top sometimes with kids. And the other thing I really want to emphasize is that we, as people who are going to work with children, we got to get over the idea, we got to be a little humble and get over the idea that we can be child whisperers, right? Like, people think that just by virtue of our occupation, we have this secret knowledge that lets us engage really, really well with kids, talk to kids, and kids listen to us and they want to engage with us just because of who we are. That is just not true. Like, kids are just as awkward with us as they are with their parents, as they are with their teachers. There's got to be a little bit of humility when you go into these situations and realize there's going to be a lot of failures that you're going to. But this is just the start of things. So let's get started. So one of the first points, and I have like kind of three major points I want to go over, but the first one is, I think it is very, very important to give the child control in the assessment. This is probably the most important thing that you can do in your assessment of a child, is give them control. Why is that? Kids are probably coming to see you because of a situation that was a result of them not being in control, right? They were feeling scared and anxious. They're acting impulsively. They're getting into trouble all the time. They're having trouble feeling happy. These are probably, for them, they have felt a sense of not being in control in these situations. Additionally, they didn't make this appointment today. Mom or dad made this appointment for them. They didn't have control over this situation. The parent had control of the situation. And so, these are two circumstances. They're coming to see you because of a situation where they felt out of control. And they're coming to you because somebody else took control of the situation and is not giving them control over the situation. And if you think about how you feel when you are out of control, right? Or control's being taken away from you, right? Maybe it's a coworker who's kind of taking over a meeting or a project that you were running, or your significant other has, told you a way in which you've neglected your personal responsibility. Your initial response to that situation is not to be, oh gosh, you're so right. Man, you're doing such a better job of this than I was doing. We should really follow your lead on this. No, it's to kind of fall back on your defenses, put up your fight or flight. And the child is no different. When they are feeling like they're here for an out of control reason and that somebody else is in control and they are not, their first response is to be defensive and to put up that fight or flight. So we want to give them control, because that will help bring those defenses down. So how do we do that? Some very simple steps. The first thing and some of these are going to just seem like, oh God, that's so obvious. Like, why is he even bothering talking about this? I, to a point of flaw, will address the child first in any situation. So let me put that out there. Draw a picture for you. If I typically am walking into a room where the parent and the child are sitting there already ready for me, and the natural thing to do is the adult will kind of be like kind of put their hand out or stand up or kind of turn their body towards me to introduce themselves to me. I will literally ignore that adult and I will walk straight up to the child and I will say, "What's your name, bud? What's your, are you so and so who I know they are?" I want this kid to feel like they are the most important person in this room because typically the most important person in the room has control in the situation. I want this person to feel like I am here to see them. They are the person that brought me here today. The parent is not my primary focus. Your parent is not my primary focus. You are my primary focus. I want the child to introduce me to the other people in the room. Who's this person sitting next to you right now? That's my mom. Mom, it's such a pleasure to meet you. I'm Dr. Patrick. Nice to meet you. Thanks so much for introducing me to your mom, Joey. Again, if you're the one making the introductions, you're typically the person who's kind of in control of the situation. Now, these are subtle things, right? Like I'm not like being overtly saying, "You're in charge here today, Joey," but it sends a certain message of, "You're in charge here today, Joey. You're the one I'm here to see, and you're the person who's going to make the introductions." I start with some very benign and obvious information that I try and get from the child. Benign and obvious is easy, it's simple, and kids can feel like they're in control of that information. How old are you? What grade are you in? Where do you go to school? Do you have brothers or sisters? These are very simple answers that they don't need to think about the answers to. And it helps them say to themselves subtly, "I can do this. This is easy. I can answer these questions. I have control over this situation." I always ask them before I do any more than introduce myself to the parent after they've introduced me to them. I always ask them, the child, "Why did this person bring you here today?" There's, again, two reasons for this. One is you are the person who I want to gain information from, right? I want to give you control of the situation. I want to gain information from you. But the second reason is I'm acknowledging that this person brought you here. You did not bring yourself here. So we are acknowledging that this was maybe potentially not of your choosing that you came here today. I want you to know, I recognize that you might have chosen not to do that. And while that doesn't necessarily give them like a control, it does acknowledge that I am, and again, in a very subtle way, I am acknowledging that, like, I understand that you weren't totally in control here, and I'm hoping that I can give you a little bit of that back. But why did you? And also, it helps them tell me, like, they can say whatever they want in this situation. I'm here today because I'm a superstar, and my parents think I'm amazing, right? That's fine. You can tell me that. That's okay. You're in control of dictating the start of this, like how we're going to phrase this interview. You're in control of that situation. I make everything as predictable as possible, and one of the ways that you can do that is explaining the process of what's going to happen today, right? So, you'll say, I always say to the child, I want to ask you more questions about the reason you just said that you're here today. First thing I'm going to do is I'm going to ask your mom or dad. I'm going to ask them one, maybe two questions. Then I'm going to come back to you and I'm going to ask you a whole bunch of questions about the things that you said you're here for. After I ask you a whole bunch of questions, I'm going to go to your parent and I'm going to ask them more questions than I'm going to even ask. Here are some subtleties of why I think kind of phrasing it that way, but setting this expectation for them is important. One, it gives them a structure, right? They now know how this is going to play out. Mom and dad are going to give their piece. I'm going to give a lot of information, and then mom and dad are going to give even more information, right? That's the structure of how this is going to go. It also sets an expectation of how much they're going to need to engage relative to the parent. Oh, he's going to ask me a lot of questions, but mom and dad are going to have to talk even more than me. So I don't really need to, I at least have to do less work than mom and dad are going to have to do today. It sets that expectation for them. So I think that's really important. When you know how things are going to play out, you feel more in control of the situation, and it helps you put your defenses down. And then this last point, this one comes up from time to time, but I'm always ready to utilize it. And that is, I give kids permission to not answer my question. Usually this is in a situation where the kid is kind of showing me some reluctance, the shoulder shrugs, the I don't know, the really poor eye contact. If I'm getting a sense from a child that they're really not, like, they're reluctant to answer a question that I've asked them, I'll sometimes call it out directly and say, sometimes when kids say they don't know to me, what they really are telling me is they don't want to answer my question. I'm wondering if that's the case for you. Do you not want to answer my questions today? No, and about 50% of the time they'll say, no, I don't want to talk to you. Thanks so much for letting me know that. It's okay that you don't want to answer this question. I'm a total stranger. You don't know me. Why would you tell a total stranger personal information about yourself? I totally respect that. Thanks for letting me know. And if there are other questions that you don't want to answer, please tell me that you don't want to answer them so that we can move on, and we can, maybe you'll feel more comfortable sharing that with me later on. Again, it gives them this kind of small level of control of, I don't have to tell this person things I'm not comfortable telling them. I'm in control of that. Because one of the things that parents will often try and say is, you need to tell this person all these things. You need to make sure you're honest with this person. I want them to be honest, but if you don't want to tell me things, don't tell me things. We'll get to that later. One of the things, the second big area I want to talk about is this idea of building victories. So I am a huge proponent of counting my wins, and I keep a scorecard as I'm in a mental scorecard as I'm going through with a child. What do I mean by building victories? So it is way easier to get information from a child if you get momentum behind you, right? This is like simple Newtonian physics, right? An object in motion will remain in motion unless acted upon by another force, right? It is way easier to get a kid to talk to you if they're talking to you. So I look to build as many victories early on, right? So that I can keep the momentum going with the child. I look at every single response a child gives me as a potential win. They gave me a fist bump or a handshake. That's a victory. That's a win. They told me what is your name? My name is Joey. That's a win right there. How old are you? I'm 8 years old. That's a win right there. Even sarcastic and defiant responses are wins, right? What's your name? My name's Michael Jordan. It's so nice to meet you, Michael Jordan. Thanks for telling me your name, right? They still used their words and they responded to your question. So that is a potential win right there. You got to be careful and I'll talk about the kind of turning losses into wins in a little bit, but anytime a child gives you a response, it's a potential win. And the more wins I can get, the faster I can get them coming, the more likely I'm going to get more information out of this child. I truly try and go 10-0 with my questions before I even start getting into clinical information. So that's everything from getting the fist bump or the handshake as I walked in the room, getting them to tell me their name, getting them to introduce me to the person who brought them in today, age, grade, school, what they like to learn about, all these things. I try and get as many wins under my belt before I even get into the question of, why did your mom or dad bring you here today? Because if I've gone 10-0 up to that point, I'm almost certainly going to get this kid to be very honest, or at least give me some sort of indication of the reasons that there's. And if there's there's a couple things I want you to take away from today, but if there's one little thing that I think you'll want you to remember is, Try to only lose once in your evaluation of a child. What does that mean? I think the easiest way to describe this is to think about selectively mute kids and engaging with selectively mute kids. So if you came into a room with a kid that you knew he was here for a selectively mutism evaluation, you, again, this person has been seen by a number of people before you probably, and has not talked to those number of people before you, and that's why they're sitting with you. There is no good reason why you are going to get any information out of this child, just like that. So if you walked into the room and you said, "Hey, what's your name?" and they just looked at you with a blank stare and kept their lips sealed, and then you followed up with, "Come on, you can tell me your name," and they just looked at you and kept their lips sealed. "Oh, you must be pretty nervous." "It's okay. Lots of kids are nervous. You can tell me your name," right? And you just kept prodding and prodding and prodding, and they just kept staring at you. You are picking up loss after loss after loss. But every loss for you is a win for them. And when you keep giving them these wins, eventually you have to make a decision as a clinician. I've got an hour to do this assessment. At some point, I have to get some information. So I'm going to have to give up on talking to this child. If you've asked them 5 questions before you've given up, you've given them 5 wins, and I feel good. All I got to do is wait him out, and he'll stop talking to me. If you've asked them 10 questions before you give up, that's even more like, wow, I can withstand 10 questions and they give up. I'm really strong. Maybe I can go for 20. It's like the bench press, right? Oh, I got 100 pounds up. Maybe I can get 110 pounds up. Maybe I can get 120 pounds up, right? This kid learns, we are positively reinforcing the idea that if I just don't say anything, they will give up on me. Doing any evaluation of a child is similar to working with that selectively mute kid. I only want to lose once, because that one loss is still a loss, and I hate the fact that I lost, but it's one. It's just one loss, and it doesn't give too much strength to the whole situation. So I only try and lose one time. If a kid won't answer my questions, I move on. And I don't engage anymore. And I find that if I actually acknowledge that I'm moving on, and that this kid, and I'll talk a little bit more of this in a minute, but let me just move on because I'll talk about it more. All right, so how do we build some victories, right? Again, we start with benign and obvious things: name, age, grade, all those kind of things. These are simple things. Again, the child doesn't have to think about these too hard. And every time they use their words, that's a victory for you, and it builds your momentum. I use labeled praise ad nauseum. So if you're going to work with kids, labeled praise is an idea you really do have to become super, super, super comfortable. It's not enough to tell a child, "Thank you," or "You did a good job," or "That was great." Those aren't enough to really encourage a desired behavior. You have to use good labeled praise. "You did a great job using your words to answer my questions. It helps me understand what's going on," right? You identify, you said it was a good job, you said what they did a good job of, and you said why it's important that they do such a good job of it. My favorite one is, "Thank you for using your words." I use that phrase kids, the older kids kind of look at me like I'm an idiot sometimes, but it still works on all age groups. "Thank you. What's your name?" "My name is Joey." "Thank you for using your words to tell me that your name is Joey. How old are you?" "I'm 8 years old." "You're 8 years old. Fantastic. And thanks again you're doing such a good job using your words to answer my question." "And who's this that you brought with you here?" "That's my mom." Nice to meet you, Mom. I'm Dr. Pat. Thanks so much for using your words to introduce me to your mom. I really appreciate that. Even if they don't use their words, right? I think if there's one phrase that you can take from today, "Thank you for using your words. Thank you for using your words. Thank you for using your words." That will get you miles in this. But even if they're not using your words, you can still give them good labeled praise for everything they're doing, right? Do you, when you're at school, do you listen to what the teacher says to do? I don't, and they give you a shoulder shrug. I don't know if you guys can see me, but they give you a shoulder shrug. Thanks so much for using a shoulder shrug to tell me that you're not sure if that's something that I would see you doing. That's really helpful. Thank you for shrugging your shoulders to communicate that to me. Right? You can use labeled praise for everything. They were standing up and walking around the room and then they sat back down. Thank you so much for sitting back down. It's so much easier to talk to you when you're sitting right in front of me than me turning my chair all over the place to follow you. That's awesome. Thank you. I know we get into this there's this, the big idea, when you're doing evaluations and interviews of patients is the whole idea of open-ended questions. Start with open-ended questions. And I do truly believe that. But when you're working with kids, I think early on to build victories and to gain some momentum, it is perfectly fine to use yes, no questions. And in fact, I think even it's very important to use yes, no questions and to actually say, ask your question and then say yes or no, because it gives the child an ability to not think, to just pick one of two words. It's a multiple choice question for them. There's two choices, yes or no, right? You're making it easy for them. And again, this isn't for the purposes of the clinical side of this. This is for the purposes of just gaining your momentum and building victories so that when you start asking clinical questions, you're going to get somewhere, right? Do you like to read books? Yes or no? No. Thanks so much for using your words to tell me that you don't like to read books. I appreciate that. Do you have any siblings? Yes or no? Yes, yes, I do. That's awesome. You have some siblings. Thanks for telling me that. Do you have a brother? Yes or no? No, I don't have a brother. Oh, do you have a sister then? Yes or no? Yes, I have a sister. Fantastic, right? And I know as I'm saying it now, it kind of sounds like stupid and like redundant, but like the more and more you get this child to just use simple words like yes and no, the more they will be more likely to use more complicated words like I get angry or I rip my desk or I feel sad. And turning near losses into wins, right? So again, kids who are coming, especially for behavioral issues, are likely to give you a run for your money with this. But I don't just accept the fact that a kid's been defiant and tried to throw me a loss when I've asked them a question. I try and turn any potential loss into a win. So if a kid says to you, again, if a kid says, I say, who's this person that you brought with, who's sitting next to you today? Oh, that's my daughter, right? Okay, there's a 45-year-old woman sitting next to an 8-year-old child. Obviously, it's not their daughter. I could correct them in that moment. That'd be a choice I could make. But I could accept that as a loss because I see you're choosing to be sarcastic and answering me. I could choose to do that, but the reality is I can turn that into a win by taking the win away from him or her. Oh, this is your daughter. It's so nice to meet you. You're looking wonderful for your age, right? I can take that loss away from myself. I can turn that loss more into a tie, even a win sometimes, if I don't acknowledge the defiance associated with it. I just acknowledge it as they responded to my question. Even like the shoulder shrug. The shoulder shrug is a defiant response in some case. Thanks so much for shrugging your shoulders to let me know you don't know, right? I could have accepted the loss, but I'm not going to. I'm going to focus on the fact that they use their body to answer my question, to respond to me. That's a win. That's a win right there. All right. So when I was making this slide, I asked my wife, I said, I'm trying to say, how do I tell parents to shut up when being nice about how I say it? So limit parent interference was the best I came up with. When really what I wanted to say is, I need you to stop talking, mom and dad. So parents are really, really eager to answer questions that are being asked. Even if they're not being asked to answer a question, you could have your back to the parent and be looking at the child and say something like, what's the reason you're here today? And the parent is more than willing to talk over your shoulder and answer. They are super eager to answer. Why? They're the ones who made this appointment, right? The kid didn't make this appointment. They made it. When you make an appointment for, to go to the barber or the hairdresser, and they ask you, what can I, how can I cut your hair today? You don't expect somebody else to answer for you. You made this appointment, right? So it's the same thing. The natural response is, I made an appointment to have my child see a doctor. I'm going to answer questions today because I made this appointment. And they're also, in many cases, they're just conditioned to answer questions for their child. Again, this is a subset of children who are coming to you for, there's something going on that they're coming to see you for. More than likely, this kid doesn't answer questions all that well, right? More than likely, they are reluctant to respond to strangers, whether that's because of anxiety or defiance, or their just inability to stay focused long enough to answer questions. So the parent is very conditioned to saying, well, we've been having trouble at home with blah, 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 right? They're just very conditioned to do it. My personal opinion is that the greater the ratio of parent to child input is, it dramatically skews your ability to do a good assessment. And why is that? If I look at parent information as and it's not objective, it's not objective at all, because parents are putting their opinions into all this. Then they have an opinion on the whole matter, which is fine. But if I look at it as objective information, right, it's outside the child's experience, and I'm getting a lot of objective information. What I'm missing in this situation is the child's subjective experience. The objective information might be that the kid is, fighting at school. He's refusing to do his work. He's breaking things at home. These are all objective pieces of information, things that are actually happening. But that doesn't tell me anything about how the child is experiencing those things. And I'm not going to directly ask the child, so how do you experience, what's your experience when you're beating up kids at school? Or what's your experience when you're refusing to do your homework? That's not the question that's going to be asked. But there are some subtleties about what the child might say to me that give me an indication of what their experience of that is. Even if it is, other kids are making fun of me, so I beat them up, right? Okay, your experience of this situation is that kids are making fun of you. That's your experience of the situation. But that may not be what's happening, but it's your experience of the situation. If all I'm getting is parent information, I'm probably going to miss a lot of that patient experience. So it's important to keep that ratio as even as possible. And I think it's really important to set the expectation that you do not want the parent to talk too much. I am fine with setting that in expectation for parents. Now I'll kind of go through that now. So I set the expectation of what the format is. We've already talked about that. I kind of go through. I'm going to ask your parents a question. I'm going to ask you some more questions. I'm going to ask your parents a lot more questions. I think it's equally as important to say that for the parent as it is for the child, right? I'm saying, if you think about this, how the parent might hear this, all right, Joey, I'm going to ask you some questions about all of this. But first, I'm going to ask your parent one or two questions about this. Then I'm going to ask you a bunch of questions about that. Then I'm going to ask your parent even more questions, right? The parent's going to hear, I'm going to get my turn now, and I'm going to get the opportunity to say a lot of information about all this. And then even during the time that I'm talking to the child, I'll reiterate that point in the middle by saying, you're doing a really great job answering my questions, Joey, and I really appreciate that. I only have a few more questions for you, and then it's your mom's turn to answer these questions, right? Okay, it's almost my turn. I'm gonna get my opportunity. This is a hard thing to do sometimes, and maybe this is just me, because again, like I said at the beginning, sometimes people tell me I'm a bit over the top. But I do use a different tone when I'm talking to kids versus when I'm talking to adults. And I think this has a subtle implication associated with it, which is that it's child time and it's adult time to talk. And that helps the parent distinguish between who is being spoken to in this moment. Is it me who's being spoken to, or is it the child that's being spoken to? So what my tone is I try and make it as subtle as possible. If I think of like a young child, like a 5-year-old, when I'm talking to them, I might talk a little bit like this, right? And this is how I emphasize things, the way I use my inflection. And that's probably as much as I take it to versus when I'm talking to the adult and I'll talk more like I'm talking right now. Adolescence, it's a little bit more subtle. I might kind of just talk a little bit like this when I'm talking to an adolescent versus when I'm talking to an adult and I'm talking like this. Again, you got to find your comfort zone with that. But I do think that subtle tonal difference in the way that you use your voice, whether you're talking to the child or you're talking to the adult, does help the parent separate themselves out from when is it my time, when is it their time. If a parent tries to jump in and start answering questions, I have no problems with telling them, I need you to not talk right now. Now, I do it very nicely. I try to do it nicely. Hey, I promise you, Mom, I'm going to ask you all of these questions. And I really appreciate the answers that you're going to give me. But first, I want to hear what Joey has to say. Right? I promise you, I'm coming back to you. But first, I want to hear what Joey's got to say. Right? That's what's important to me. Similarly, if a parent tries to force the child to respond to me, or is attempting to discipline them in the midst of me talking to them for something that they're doing, I will redirect them. Mom, Dad, don't worry. I need to see this. This is why you brought your child here today. I need to experience what you experience, what school experiences. If I experience it, I can't help you if I don't experience it, right? It's really important for me to experience it. Also, if a kid's not responding to me, hey Joey, what's the reason? What's the reason that your mom brought you here today? And I get the crossed arms and just looking down kind of situation. The mom says, Joey, would you please talk to him? We're never going to get anywhere if you don't use your words. You don't talk to doctors who are here to help you. Mom is just further reinforcing this idea that not answering my questions has power behind it. Mom, I will handle this. Don't worry. It's okay, Mom. I got to see this. If this is what Joey does, then I'm okay with Joey doing this. I need to see what Joey does. And at the very beginning, I always ask them, again, parents are very eager to answer these questions. And so if I just said, Mom, what's the reason you're bringing your child here today? I probably have another 20 minutes before I need to say anything again, because they're just going to roll off a ton of things that's going on. So I always, to start the interview, because I want to get back to that kid as soon as possible, I will always say, I am going to ask you, I promise you, I'm going to get all the information, all the data that you have to tell me. But if you could summarize your concerns in 1 or 2 sentences, what would you say your major concerns are? And usually that's still like a 5-minute conversation that I don't have to talk for, which I will try and redirect earlier than that. But I can at least shorten the situation up, and I've given the expectation of you get 2 sentences. And I have permission at this point to cut you off after your 2 sentences because I do want to get back to Joey. A little bit more information about gaining some clinical information from the child and some subtleties of things. So first off, you don't need to be perfect the first time you do this. Working with kids is not easy, and you're not going to get all the valuable information that you need. I always say to parents, like, we're in an unnatural situation and in an unnatural environment. Any kid can have a good hour. I've had kids who have some of the most severe ADHD in the world who have sat in a session with me and not moved a muscle. And then they've come to my partial program and they are tearing it up and running all over the place and destroying the room, right? But in my assessment of them, they sat still. I always tell parents, this is super unnatural to be in this environment. Any kid can have a good half an hour. Any kid can have a bad half an hour, right? Today is not the end all be all. There's plenty of opportunity to get more information about that. When I'm asking kids now I'm getting into the clinical piece of this, and I'm going to ask them information about what is actually happening, the details of why they're coming here. I focus on asking them, what would I see if I was in that situation versus what do you do in that situation? I find that what would I see is a far less judgmental question than what do you do, right? What do you do implies that something is happening, right? Something is happening that you're doing it versus what would I see just has a subtle difference of there are things happening and I want to know what I'm going to see. I could see you reading a book. I could see you listening to the teacher. I could see you talking to your friends. I could see you walking around the room. I could see you running out of the room, right? I could see all of these things. But I feel like it's a subtly less judgmental question that gives the child permission, again, going back to giving them control, it gives them permission to answer this question however they want to. And they could say all these things like, I do all the right things in class, even if that's not true. They could say that. When kids say things like, you'd see me get angry, right? I don't like to just leave it at get angry, or you'd see me not listening, or you'd see me paying attention, right? That can mean a lot of things to a lot of different people, right? That's not very descriptive of the situation. Anger for me, when I get angry, does not look like when my daughter gets angry, or my wife gets angry, or my coworker gets angry. We all look angry very differently. When I'm happy, it looks very different than when my wife is happy or my daughter's happy. What does that look like? Again, tell me what I'm going to see if I saw you feeling that way, right? If I saw you being happy, what would I see you doing? If I saw you being angry, what would I see you, what are some things I would see with my eyes? And kids are surprisingly really, really good at saying, well, when I'm happy, I have a smile on my face. I usually am laughing a lot. I'm probably talking a lot when I'm happy, and I am I'm moving around a lot. Like I'm really energized when I'm happy. When I'm angry, I have a scowl on my face. I am slamming my fist on the desk. They're really good at telling you these physical things that they do, right? Because emotional things are very abstract concepts that can be difficult for kids. Angry, happy. Those are hard to describe what that feels like, but they can tell you what they do or what physically happens, right? My heart races when I'm scared. They can tell you what they do when they are kind of describing an emotional state. And I think it's really important to not just, this gets into mental status exams, but it's really important to notice how a child answers the question, not so much what they say, right? So when you're at school, do you ever get up out of your chair and walk around the room? No. And then they look over at their parents, and then they look down at the floor, right? What just happened there, right? Like something was off in that encounter, right? They knew to double check with mom over their answer. Like, is it okay for me to say I don't do this because I really do this, right? There's a subtlety of that, right? The arms cross, the head down, right? As they're answering questions, the smile on their face as they tell you they get really angry and beat kids up at school, right? Like the inconsistencies with their physical appearance and the way that they're answering these questions gives you a lot of valuable clinical information, more than maybe their words are actually giving. And then I always make sure I'm asking a kid, is there anything we did not talk about that you think is really important that I need to know? Because I tend to not get into things, on my first encounter, about physical or sexual violence with a child, because again, I'm a stranger, and that's a hard concept for kids to talk about in general, and I feel like it's re-traumatizing. But if that's important for the child, that they really want to share that with me, I want to make sure that they feel like there's an opportunity to do that. And this is a good opportunity. Sometimes I really like Sonic the Hedgehog. Thank you for sharing that information with me. If a child is willing to share some information with me when I ask them, hey, is there anything we didn't talk about that you think I should know about you? And they share something, whether it's clinically relevant or just a socially relevant piece of information. I'm like doing backflips because that shows that they actually wanted to share, right? They were not prompted to answer a specific question and they just came up with something to share. I think that's awesome. All right. So this is the point where I'd say any questions, comments, concerns, or any good jokes to a child, because I'm finishing up my evaluation. It's really kind of the key concepts, again, kind of perfect timing, running up to that hour mark, 45 minutes or so we went over. I don't know if anybody else joined while we were talking. Why don't, Carmelin, can you bring our videos back up? Or not?
Okay, hold on for 1 second. Can everybody?
Still with me?
uh, we've had a few more people actually join us. Can you hear me?
I can hear you, yeah.
All right. Does anyone have any
So,
questions? You guys can unmute yourselves if you have any questions. I know there was a couple of questions in the chat box.
oh, okay, great. Before I go to the questions, just guys, I'm gonna unshare my screen in a second so I can see people. But this is the contact information for me. If anybody wants to get a hold of me, that's my cell phone number. You can feel free to call me on my cell phone. That's fine. That's my email. Feel free to call me. And then if you have any questions that you'd like to throw kind of CFG's way, Carmelin is a great person to contact, and she can be helpful with that. So I'm going to unshare my screen. So does anybody, okay, let me look in the chat. Please put questions here. Do you prep the parents about your strategy prior to your first meeting? I don't prep the parents prior to my first meeting with them. And I used to actually. So I worked in a different environment maybe 3 years ago where I had was kind of in a private practice outpatient setting. And I would sometimes have a phone contact with parents beforehand because they had concerns about bringing their child in. Outpatient private practice psychiatry, I feel sometimes is people shopping for a car. People will go to a bunch of dealers before they pick their, actually put money down. And so they vet you beforehand about whether or not you're the doctor they're going to come and see. But I don't normally prep them. If they had specific questions, I would answer those questions for them. But otherwise, I don't really give them a heads up on how it's going to work for the day. I don't think there's anything wrong with that. I just don't feel like I need to do that. I feel like I can get to the same place without doing it. But if there's more questions you have about that, I'd be happy to answer it. Was that Kimberly who had that question? I'm trying to see how the order of this is.
Oh, that was me.
Oh, that was you. Okay, gotcha. Was there ever a time during your initial encounter you felt the child would be more engaged in the interview if the parents were not present? Yes, I do. I have had that happen before many, many times. So the way I used to do my evaluations when I was in a private practice and I had more time because I had an hour and a half set aside to do an evaluation. I would bring everybody into the room initially and just kind of do introductions the same way I just described it, and then explain the process. And I would say mom and dad are going to sit in the waiting room. We're going to talk for a bit. Then I'm going to have you sit in the waiting room, and mom and dad and I are going to talk for a bit. And then I'm going to bring everybody else together and we're going to have a conversation. And I think that works actually really, really well as too. In a more limited setting where I have less time to do an evaluation, I don't separate them. simply because of the logistics purely of like escorting people out of the room and bringing people back into the room. I mean, sometimes 5 minutes is super important for me to have enough time to get do my job. Um, but that's why I think you got to find a style that really works for you. But there are pieces of information that I do find kids are are less likely to have an honest conversation about, obviously, than if their parents are there. If they're not there, obviously, sex, drugs, alcohol, these are really important things that when you're assessing, you do want to have an opportunity to have a private conversation with the child. Um, I always ask the parents that too, with, if, when I don't necessarily worry about it at the initial encounter. I mean, sometimes if I'm getting a vibe that there's like, I think there might be a bigger issue here related to like sex, drugs, and alcohol. I will, bring, the parent out of the room. I'll make a special case for that. But it's not necessarily something that I, regularly do. But I think it's sometimes like those three topics, sex, drugs, and alcohol, are something that really, I think it is important to have a conversation both with the parent separately and the child separately. It doesn't have to be on that first encounter. Kimberly, was there anything else that you would like me to comment on with regards to that?
Kim, you might be muted, so
Oh yeah,
you'll have to unmute yourself.
Oh, no, you answered it very well. Thank you.
oh, okay, great. Um, does anybody else? So I see there's a number of extra people on the call from when we first started. Mary's on the call, and
Dr.
I don't know if
Ayesha
this is
Salman.
Dr. Isha. Okay, yeah. And somebody else has a phone number. Does anybody else have any questions, or it doesn't have to necessarily be related to what we talked about, though that would be helpful because I was prepared to talk about it. But if it's something else, feel free. And you might be on mute. Hello?
Yeah, it looks like the 732 number is trying to say something, but we can't hear it.
Oh,
If you
okay.
have a question, you can also type it in the chat box if for whatever reason your microphone isn't working.
And obviously, if there's questions that you guys think of later, you can always email them to me, or you could email Carmelin and she could forward them along to me.
Yes, and this webinar was also recorded, so we will be posting it probably on our website as soon as we can. And if you also, I don't know, Pat, you said you were okay with giving out the presentation?
Yeah, I'll put it in. We'll make a PDF of it, and people can do that. Can have a PDF form of it. That's totally fine. The slides are more for me to keep on target than they were for for their valuable information.
It looks like there's another phone number that logged in. If you have any questions, we were just saying that this presentation was recorded and will be posted.
All right. Well, if nobody has any questions, going once, going twice, sold. I really want to thank everybody for joining. I really appreciate the opportunity to talk to people and to teach. It's a great opportunity. Carmelin, thank you again very much for setting this up. Teddy and Carly, the same to you. And again, if you guys do have any questions, feel free to email me or call, and I'd be happy to chat. Oh, wait, somebody did add something in the chat real quick here. Hang on. It looks like, oh, maybe not. I thought it said there was an extra chat thing. All right. Well, you guys, everybody have a great day. Be safe, be healthy, and hopefully we'll get to be in front of each other someday soon.
Thank you. And
Thank you very much.
We do have another webinar coming up this coming Monday at 6:30 p.m. It's going to be stress management among psychiatrists. So if you're interested, let me know. I did send out emails and the link for that as well. So we hope to see you there as well.
Actually, and I have just a quick question. Was this helpful for anybody who's still on the call?
Yes.
Thank you very much for that one. Yes, that was fantastic.
I thought it was very helpful.
Building
it's like,
myself this